Scale for the Assessment of Negative Symptoms, SANS. The contents are: Introduction, Purpose of Assessment, Type of Assessment, Components being assessed, Indications and Contraindications. Demonstration include: Administration procedure, Administration time, Scoring procedure, Interpretation. Next is psychometric properties. Advantages of SANS and disadvantages of SANS. Introduction. SANS was developed by Nancy C. Andreasen in 1982. It was the most commonly used rating scale to assess symptoms of schizophrenia. It was widely used in both academic and pharmaceutical industry trials. SANS separates negative symptoms from positive symptoms and depression. It is complemented by a scale for the assessment of positive symptoms, SAPS. SANS was available in English, Thailand, Spanish and Chinese version. Purposes of SANS. SANS is the most widely used instrument for measuring negative symptoms in schizophrenia. It is to facilitate evaluation of 5 important symptoms frequently observed in core schizophrenia. These symptoms include affective flattening, alogia, which are poverty of speech and thought, avolition, anhedonia, and attentional impairment. Type of assessment. SANS is a standardized assessment. It is a clinician-rated where the rating of each of these components should be based on multiple sources of information, including direct observation by the investigator and others such as nurses, reports from the patient's family, and reports from the patient himself. Component being assessed. SANS measures negative symptoms on a 25-item, 6-point scale. Items on SANS are clearly defined in the assessment form. Items are listed under the 5 domains of affective blunting, alogia, avolition or apathy, anhedonia or asociality, and attention. Affective blunting. Item 1. Unchanging facial expression. Item 2. Decreased spontaneous movements. Item 3. Paucity of expressive gestures. Item 4. Poor eye contact. Item 5. Affective non-responsiveness. Item 6. Inappropriate affect. Item 7. Lack of vocal inflections. Item 8. Global rating of affective flattening. Alogia. Item 9. Poverty of speech. Item 10. Poverty of content of speech. Item 11. Blocking. Item 12. Increased latency of response. Item 13. Global rating of alogia, avolition, apathy. Item 14. Grooming and hygiene. Item 15. Impersistence at work or school. Item 16. Physical energia. Item 17. Global rating of avolition, apathy. Anhedonia, asociality. Item 18. Recreational interests and activities. Item 19. Sexual activities. Item 20. Ability to feel intimacy and closeness. Item 21. Relationships with friends and peers. Item 22. Global rating of anhedonia, asociality. Attention. Item 23. Social inattentiveness. Item 24. Inattentiveness during mental status testing. Item 25. Global rating of attention. Target population is for schizophrenias. Indications and contraindications. The indication of this assessment is people with negative symptoms, such as schizophrenia, schizophreniform disorder, or schizoaffective disorder. While the contraindication of this assessment is mental retardation, and severe head injury or neurological disorder. Administration, scoring. and interpretation. Administration time. About 30 minutes. The administration of the scale required semi-structured, relatively formal interview. Although no time frame is specified, it is advised to ready the patient based on their behavior in a month. Administration procedure. 1. Prepare questions before the interview. 2. Observe the way patients answers the question. Patient's body language and appearance. 3. Interview carer or nurses for additional information about patient's social activities and persistence at work or school. Short clip of administration procedure.
Good morning, how are you today? Good. What were you doing before you came here? The name is did you have fun getting it? No. Why you didn't have fun? I don't know. I heard your mom came here yesterday to visit you. Did she came alone? No. So she came with your sister? No, no problem. How was it? You were happy meeting your parents? Happy? Really? Why you were happy? Was the food delicious for you? Yes.
Rater can ask any questions to elicit answers needed to complete the scale later. As example, how was gardening activity? To know whether patient enjoy the group activity. Next, asking about family to assess ability to feel intimacy or closeness with family. It's a 6-point Likert scale. 0 indicate none. 1 indicate questionable. 2 indicate mild. 3 indicate moderate. 4 indicate marked. 5 indicate severe. Subscale score are the sum of all items, including the global rating item. Global summary score can be obtained by summing each of global item. For the interpretation, the higher the score, indicate more severe symptoms. Psychometric properties. Reliability. Internal consistency. The Cronbach alpha of SANS items ranging from 0.628 to 0.834, while the scale as a whole is 0.855, which indicates that the internal consistency of SANS is acceptable. Test-retest. The kappa coefficient of SANS items in variety of cultural settings, ranging from 0.628 to 0.945, which indicates substantial to almost perfect agreement. While the ICC between raters ranged between 0.67 to 0.99, which indicate moderate to almost perfect. Inter-rater. The inter-rate reliability for all items of SANS, excluding subjective and global rating, was found to be significantly high, ranging from 0.59, which indicate moderate, to 0.96, which indicate very strong. The inter-rater reliability for subjective rating, global rating, summary score, and total score was also significantly high, ranging from 0.76, which indicate strong, to 0.98, which indicate very strong. Validity. Convergent validity. SANS were significantly correlated with the clinical assessment for negative symptoms, or CANES. There is a very strong correlation between SANS effective flattening with the CANES expression, with R value 0.914. There is a strong correlation between SANS alogia with CANES expression, with R value 0.668. A moderate correlation was also found in SANS anhedonia sociality with CANES motivation pleasure social, with R value 0.583. SANS volition apathy with CANES motivation pleasure vocational, with R value 0.548. and SANS anhedonia asociality with Kane's motivation pleasure recreational, with R value 0.434. Advantages. The advantages of the assessment is, it can separate negative symptoms from positive symptoms and depression. Next, the psychometric properties have been repeatedly and carefully evaluated. It also has become a standard scale for measuring negative symptoms, as it has been widely used in a variety of settings. Besides, it can be completed quickly and efficiently, once the investigator are familiar with it. Finally, SANS can be used to map the response to treatment in clinical drug trials, and evolution of symptoms over time. Disadvantages. The disadvantages of this assessment is, it cannot be used alone. It needs scale for assessment of positive symptoms. Taken together, the two scales provide a comprehensive set of rating scales in order to measure the symptoms of schizophrenia. SANS also have been criticized because it include items that measure cognitive functioning, which have been now recognized as a distinct category from negative symptoms. References. This is the lists of references used, for the purpose of creating this video. Thank you.